This is skill 11.5, turning a client to the lateral or prone position. I'm going to tell you that prone position isn't used very often. What is prone position? Think about it. What did I tell you it was? That's right. Prone is you are prone to somebody stabbing you in your back. So if you're prone to somebody stabbing you in your back and you're in bed, then you have your back up, so they're laying on their belly, okay? All right, so that's prone. Got it? All right, so then I'm not going to show you about turning a patient prone in bed because it's not used very often. Evidence states that you really should have a bed that would rotate the person completely over onto their belly. So I don't know of many hospitals around this area that have that. So that would be something that would be trainable in the facility that you're working in if they really want to put somebody on a prone position, okay? But basically it would be just on their belly, and you'd make sure that their face isn't down and planted into the pillow when they're able to breathe, okay? All right, so turning to a lateral position. What's a lateral position? Okay, yep. You have to think about lateral is your side, and how do you remember that? Okay, the way that I do it, and this is my brain thinking, an L is thin. It's long and thin. And what's the thinnest way of looking at a body? That's right, on your side. So lateral is side, if you can remember it that way, okay? It might help you. I don't know, may not. So we're going to turn to a lateral position. So how are we going to do that? Well, first of all, we're going to gather equipment. What equipment do we need? Well, we need pillows or blankets or towels, something to stick behind people to keep them onto their side, okay? All right, and then we might need assistive personnel. If the patient is somebody that fights you, okay, like little old ladies, they don't know any better, and they've fallen 1 or 2 or 3 or 4 multiple times. And so when you go to roll them in bed, they get very, very anxious. And what they'll do is they'll grab a hold of the side rail and they'll push with all their might, and they'll push it and push it and push it. And there's no way that you're going to get them to turn by yourself. You're going to need help. Or you get that really obese person that you're looking, going, yeah, I can't do that on my own. So you're always going to want to get some help, okay? So take into consideration your patient, and you may need to get assistant personnel to help you. And then you're going to perform WIPSA. You all know what that is? If not, go back to week 1, look it up. Okay, so how do we turn to a lateral position? Well, first of all, we're going to lower the head of the bed completely, or to a position as low as the client could tolerate. So if we have a patient that is respiratory compromised, meaning that they don't breathe very well, laying flat may not be a good position for them, okay? So we wouldn't want to lay them flat. We would have their head up just a little bit, right? Okay? Remember, part of WIPSA is safety, so our back, we want to bring that bed up to our level, okay, our level. We want our backs to be good. I'm going to try to fix this bed to see if I can get that foot of the bed up a little bit here so it's straight. There we go. All right. Then we're going to elevate the bed to a comfortable working height. Oh, I already did that, didn't I? Okay, so then you're going to position yourself and the client appropriately. How do you do that? Well, you have to determine what side you're going to roll your patient onto. If you're going to turn your patient onto your right side, you can pull them closer. Let me think about this. Pulling them closer to the left side. See, you have to think about this, people. You want to pull the patient closer to their left side of the bed, okay? And why do you do that? Because if you turn the patient to the right side, if you had them closer to the right side, you'd smush their head right into that side rail. We don't want to do that, okay? So we want to make sure that we have them closer to the left side. So you're going to move the client closer to the side of the bed, opposite the side the client will be facing. And then you're going to adjust the client's head and reposition the legs appropriately. So if they had their legs, I'm going to uncover this mannequin, okay? If they had their legs crossed like this, when you go to turn them, it's going to be, it might hurt them, might hurt their hip, might hurt their knee. So you want to make sure that the legs are uncrossed and straight, okay? You're going to watch out for any IV tubing or anything like that that you've got going on. So we'll pretend that that's tubing we should be worried about, right? Okay? All right. Oh, we got a crinkle in the sheets underneath. Oh, that's one of my pet peeves, isn't it? Okay, there we go. I don't like them crinkles in them sheets. Okay, so then you want to stand on the side of the bed nearest the client. You want to place the client's near arm across the chest and abduct the client's far shoulder slightly from the side of body and externally rotated the shoulder. What? What did I just read? So, it wants me to stand on this side of the patient. So what's the matter with this? What did I forget to do? You're right. I didn't put the side rail up, did I? Okay, why do we want to have that side rail up? That's right. We want to have that side rail up for two things. One, safety. We're rolling that patient this way. If we've eaten our Wheaties, we may just roll them right out of bed. We don't want to do that, do we? No. We also put the side rail up because then the patient's going to be able to reach over and help us if they're able to, okay? So we'll make sure that side rail goes up. Then what we're going to do is we're going to put this like this, move this arm out so this shoulder over here, okay, make sure the shoulder over here is not going to go crinkle underneath them when we roll them, okay? We'll attend to that shoulder when we do get done, and I'll show you how, okay? I'll have to pause the video and show you. But for right now, what we want to do is, if this was a real person, we'd have them put their hand up here. This is not. The mannequin won't keep their arm up there. So what we do is we want to make sure that we get our legs down like this, okay? We want to make sure that they're shoulder width apart. We're bending at the knees because we want to do the work here, okay? We don't want to do the work here, okay? If we were to do this stiff like this, all that pressure of moving the patient's going to be on our back right here. We don't want that, okay? We want that down here. We want it low, okay? We want to take it in the hips, okay? So we want to go like this, and we're going to move the patient like this. Do you see? That was hardly any movement on my part, wasn't it? I know you all get to see my rear end. I'm sorry, but that's the way it goes, okay? It is getting lower. I mean smaller. Okay, so now we would use our pillows to keep our patient up there. Okay? And this is where 2, 3 pillows or bath blankets or towels come in handy. You want to put this up against the patient. You want to have your pad up there because that pad's going to keep anything from getting on your pillows. You know what I mean? Okay. So then we put this here. Keep them up. We're going to bring them down. Okay? All right? Now I'm going to pause it because I want to show you something. All right. So now I'm back again. And I'm going to show you what we're going to do with this shoulder right here that the patient is laying on, okay? When we roll a patient like this, this puts a lot of pressure on this arm, can cut off the circulation, and then we're getting no blood flow to the arm. Not good. That's not good, okay? First of all, it'll be uncomfortable after about maybe 5 minutes, okay? They're going to be hitting their bell saying, I want to get repositioned again. You got other things, I know, you got other things you need to do, but you need to reposition your patient again. So if you do that every 5 minutes, you're not going to get anything done. Okay, so you want to make sure that you get them comfortable and in alignment before you leave, okay? So how do you do that? You're going to take their shoulder and their arm and you're just going to give it a slight tug. And what that does is it releases the tension from that shoulder and puts it more uniform across the shoulders, okay? And then that way it's not as much pressure on the shoulder. I'm going to pause at a moment and get a couple more pillows. All right, so I got a couple more pillows, and so what I want to show you is we're not done with repositioning this person on the lateral side. Okay, what we want to do is this arm over here can get uncomfortable laying the way it is. So with some people, and I'm not saying all people, okay, some people may want a pillow for that arm. So what you do is you put the pillow across them, and if this was somebody that actually bent and wasn't a little stiff, their arm would go ahead and rest right on this pillow here, okay? All right, so that's one. The next one would be for the legs, okay? You don't want to leave their legs in this kind of position, okay? What you're going to do is you're going to take this top leg, you're going to put a pillow, and you're going to bend this leg, and it's going to be resting on top of that pillow so that they have a pillow from mid-thigh to past the ankle so that it takes care of the pressure between the two legs, okay? And then what you would do is you would put up your side rails per your facility policy, correct? And then, you know, position your client in a position of comfort. And so you would ask them, is this comfortable? Is this comfortable for you? Are you having any pain? Can I get you anything? Make sure they have their call bell, okay? Now, how do you know if they're in alignment? Whenever you place somebody on their side, you want to make sure that the spine, okay, because it's a straight rod for our body, right, is in alignment with our hips. If we're just slightly off, it can cause some strain to our lower back. So how do you know? How do you know that you're in alignment? Well, if you actually go, and I'm going to pick up this camera, okay, guys, because I'm going to take you with me. I'm going to show you what I mean. You ready? Try not to get dizzy. All right. If you go to the end here, and you actually position yourself so that you are parallel, you're in line with their head, okay? You should be able to see a straight line from their coccyx area to their head, okay? And that will show you that that spine is in alignment. If you have a slight little just like this, it's not in alignment. You've got to really, really get them in alignment in order for them to be comfortable, because if not, 5 minutes, they're going to be hitting that call bell. You're going to be back in there. You're going to be repositioning, and you, like I said, are not going to get anything done all day long. Okay? So that is turning to a lateral position. That is skill 11.5.